Achilles tendon ruptures are one of the most common sporting injuries. Today we're going to discuss the anatomy of the Achilles or calcaneal tendon, the risk factors for an Achilles tendon rupture, the history you might expect, the examination, investigations, and management of them. Achilles tendon is the unification of the gastrocnemius soleus and plantaris muscles, and it inserts onto the calcaneus to allow plantar flexion of the ankle. Achilles tendon rupture occurs when a substantial force is applied to the tendon. 80% of these happen during athletic activity. There are also some risk factors, for example, being an unfit individual with a sudden increase in exercise frequency, poor footwear choice, being male, being obese, or recent fluoroquinolone use. Achilles tendonitis preceding it is also a risk factor. Common history for an Achilles tendon rupture is on forced dorsiflexion, which is commonly pushing off when you're starting to run or sprint, particularly in high energy sports like football or rugby. And they say they feel this audible pop and kind of sudden onset acute pain, like being shot in the back of the calf or in the ankle. As I say, it tends to be when you're starting to run. And one of the key things is there is a loss of the ability of the gastrocnemius to work and to plantar flex the foot. So there is an inability to walk or to continue with the sport. Alongside a basic lower limb exam, particularly at the bedside, you want to assess Simmons Triad. So this begins by looking at abnormal angle of declination. So you ask the patient to hang their feet over the edge of the bed and look at how much they dorsiflex. If one is more dorsiflexed than the other, then that might imply that the tendon is ruptured. Of course, the tendon pushing the foot normally more towards plantar flexion. You can feel for a gap in the tendon, and you can perform Simmons test, which is where you squeeze the calf, the gastrocnemius, and this will result in contraction and pulling on the calcaneal tendon, resulting in the foot moving up normally. If the tendon has been ruptured, then this will be absent. First line investigation for tendon rupture is an ultrasound scan. If a rupture is seen or still suspected, then referral for orthopedics with a view to assess with either an MRI or with conservative management is the next line in. In terms of management, if they're a highly sporting individual, so if this is a kind of a high-end sporting injury, you're going to want to do an MRI to assess the extent of the tear, and then with a view for Achilles tendon repair, which is making a small incision and then basically sewing the two parts of the Achilles back together. But if it's a less active individual, perhaps an obese individual, then you're going to more apply the RICE and hope for gradual repair on its own of the Achilles. So rest, ice, compression, and elevation, similar to what you would do with a sprain. What bone does the Achilles tendon attach to, and what movement is it responsible for? What is the common history that you would expect from an Achilles tendon rupture? What is Simmons Triad, and how is it useful in identifying an Achilles tendon rupture? And what would be the investigations and management?